As the number of official United States coronavirus cases skyrocket past 280,000 with 7,000 deaths and a million cases worldwide, we're now starting to see a number of critical moral questions come to the forefront, which were once thought to be only questions which could be resolved through technocratic means. For instance, right now, the CDC has now flipped its recommendation that United States, just people walking around should wear coronavirus masks or wear some kind of surgeon mask or N95 mask or something, basically any kind of fabric to cover their faces. Now, Donald Trump has now come out and said that he will not be following this recommendation, and he stressed in the press conference that this is only a recommendation, it's not mandatory, it's just a recommendation. But some people in the White House are now debating whether or not that was a good move or a bad move. I mean, after all, you could imagine that the sort of visualization, the visual effect of seeing the President of the United States wearing a mask could be strong enough to convince a number of Americans to at the very least wear a scarf or something around their face, which we have seen from a number of correlational studies now. It is the case that that does seem to be one of the biggest correlations between countries which are able to successfully handle coronavirus and those which are not. For instance, Japan has only implemented approximately 500 tests per million, compared to the United Kingdom, which is considered to be a country which has not tested enough. The United Kingdom has tested about 2,400 cases per million, and that doesn't seem to be, a lot of people are criticizing that as being not enough. But of course, the United Kingdom has significantly a much worse outbreak on their hand compared to Japan, who doesn't seem to be conducting a lot of tests, but they do have a lot of people out there wearing masks. And just for reference, the United States has tested approximately at this point 3,600 people per million, compared to South Korea testing about 8,000 people per million and Norway at 17,000 per million. Now, to be fair, some of those numbers, especially in the case of the United States, the reason why there were so many tests is because those countries dragged their feet a little bit more, at least in the case of the United States, and so needed to actually implement more tests. Countries like Singapore, South Korea, as I was mentioning, and Australia really jumped on it, from the get-go, and were able to prevent the actual need to, execute a whole bunch of tests. So that is one thing which is going well. But we're also seeing other concerns with the kind of vocabulary which is going forward as it regards how to test how to talk about the coronavirus. So it was thought, of course, that when we talk about registered cases, what does it mean to have a confirmed case? What does it mean to say that someone is asymptomatic? Those differences of vocabulary seem to these are differences of vocabulary which seem to differ country by country, state by state, and as a result, it's leading to a lot of confusion worldwide, right? Where some countries can report asymptomatic people report and say, oh, this person is asymptomatic, and so they're not counted as a confirmed case. We saw China doing that, whereas the United States, if you're asymptomatic but still reported back positive, it's a confirmed case. In some countries, it's, well, if you're asymptomatic for a certain amount of days, then you're not considered a confirmed case, even if you're tested positive. And so, a lot of these numbers are really difficult to tell. A lot of these numbers are, up in the air. And of course, in the case of China, there's also at this point plenty of evidence that the official numbers are just not even like they're definitely approximations, right, to say the least. They seem to be kind of made up a little bit to prop up the government. So that's one big concern which we're having. But we're also having other concerns where it regards how to distribute some masks and ventilators, because of course the debate which we're having right now is, should United States companies be forced to produce only for the United States, or should they also be allowed to send out shipments to other countries? So recently we saw Tucker Carlson come forward and basically hit 3Ms for producing and sending out masks to other countries when there's a crisis here at home. Shortly after, the day after, on Twitter, Donald Trump invoked the Defense Production Act against them. Now, this is causing a little bit of an international crisis where Canada, and of course some of the Latin America as well, is upset, saying that this basically means that those shipments which were going to go to Canada, were going to go to certain Latin America countries, are now only going to the United States. And so, Canada, Justin Trudeau is a bit upset at Donald Trump for this, and that sort of seems to be a revolving sort of a negotiation which we're going to have to watch going forward. But one of the interesting debates around this is, of course, this debate between kind of globalism and nationalism. And we're starting to see it really split, not just along lines of left and right. We're seeing people on the left, some people on the left saying, well, hold on, you can't be stopping shipments, which were going to go to Canada, and then now only redirect them to the United States. That's not fair. But we're also seeing people on the right making those claims. But we're also seeing people on the left making the claim that, well, this is a good thing. We should only be sending, all of our resources, all of our production needs to be here at home, needs to be for this country, because that's where the crisis is, that's where the concern is, and we're also seeing that play out on the right. And so it seems to be an interesting divide between sort of nationalism and globalism, or at least some kind of free trade debate, and that doesn't seem to be correlating, at least as of yet, clearly along any kind of left or right dimension. There seems to be people, espousing both views on each side. So that's one interesting debate which we seem to be having right now. And of course, also we saw a hijacking of United States shipments which were destined to go to France. They are now accusing the United States of essentially having hijacked the hijacked the supply. Now, in my opinion, that's a slightly dramatic word to use, but basically what happened, allegedly, the United States is denying it, but it seems like it did happen. There were United States negotiators who were basically on the tarmac while this plane was about to take off with shipments to France, basically negotiating to pay 3 or 4 times the price than what France was going to pay in order to send those supplies to the United States. So there seems to be negotiations and things like that happening as well. And the United States was criticized for that by France, and Germany has also been criticizing, although we should also be fair about this and say that both France and Germany have done the exact same thing, have been doing the exact same thing over the past few days. So this does seem to be a bit of a kind of international crisis. There simply is not enough supplies going around, and so countries are left to basically negotiate on the tarmac, trying to figure out trying to get as many supplies as possible to their country, and that just seems to be what's playing out. It doesn't seem to be any particular country which is doing that. And then, of course, the other question which we're having in this country right now, the other philosophical debate, is how do we actually allocate the resources which are already here in this country? How do we allocate the various ventilators, masks, resources, et cetera, et cetera? And there seems to be at least 3 ways in which we could think about the problem, at least philosophically, at least 3 that I've thought of. Maybe you can think of some more. You can let me know in the comments. But the first that I've thought of seems to be you can allocate it by chance. You can allocate it either A, by some kind of direct lottery. You spin a ball and randomly see who gets the ventilators. The other way, by chance, would also be on a kind of first come, first serve basis. Both of those seem to be, at least according to some kind of model of chance, whether whether it's first come, first serve, or whether through some kind of random lottery you're allocating the resources to people, or you can allocate it to the people who are most likely to survive, even if that does seem to discriminate among people who are older, or people who are of poor health, maybe people who are obese, et cetera, seem to be at higher risk. And so you would allocate it to the younger people, allocate it to the people who are maybe more physically fit, because those people are most likely to recover and most likely to have sort of more years of life going forward. And so you would argue that those are the people who would get the ventilators. The third way which you could allocate it is allocated according to some kind of conception of who is most deserving in terms of how much they've contributed to the common good. You could say that in this instance, that should be to doctors, nurses, and other people who are critical and essential to the healthcare industry, that those people should be allocated for ventilators and other resources first and foremost, because we need those people more. But other ways in which you can allocate according to that same principle would be, if you have a former veteran, someone who used to serve in the military, you say this person is, gets a little bit more likelihood. If there's, a kind of tie in other areas, you say that person is more likely to get a ventilator because they have at one point contributed to the common good. They sacrificed for this country at one point. And so, look, you know what? We're going to step in and we're going to say that we're going to, give back to you in this instance. You could also allocate it according to, various civil and civic leaders in local communities, people who maybe lead a food bank or something of the sort, some kind of allocation along those lines. Obviously, I don't necessarily have the answer of how you should allocate those various resources. Those are very, very difficult questions, and it does seem like all of those different kinds of considerations come into play. I mean, if you're asking me, I do think that at some point you have to consider likelihood to survive. But I also think that it is very important to weigh doctors and nurses and various hospital people, especially in this case of a global pandemic. The one suggestion which I would make is that I do think that we should separate the question of who should live and die from the people who are actually providing the care. I think that if you're asking the nurses, asking the various doctors who are caring for any particular patient to make those personal and very difficult, very weighty moral decisions, I think that's more for any mortal to bear. I think that question is too tough. So those kinds of questions I think should be offloaded. Offloaded might be the wrong word, but they should be left to other people as opposed to the people who are actually providing the care, because that's just too much moral exhaustion on top of the physical exhaustion which comes from all that care in any case. So whatever principles should be applied, I mean, that's a question of public debate, of public philosophy. But whatever those questions are, I do think that if I could make a contribution to the debate, I would suggest that nurses and doctors should not be the ones personally making those decisions. So anyway, I mean, it does seem to be that, philosophy is, as it has always been, the central feature of the city. So anyway, if you like the video, I'd really appreciate it if you hit the like button and consider subscribing. Thanks.